Hello, I'm Dr. Quinn. Thank you for watching this Teach the Teacher seminar. This particular seminar is dedicated to the diagnosis and treatment of pneumonia in the skilled nursing setting. The purpose of the seminar is to increase the communication between yourselves and myself, the nurse and the doctor, in the skilled nursing facility. There's a lot that we can improve on together. During this particular session on pneumonia, we will give you a pre-video survey. We'll have you watch a video, and then we'll give you another survey to see just how well you did understand the concepts of treating patients in the SNF setting who particularly have respiratory illness and pneumonia. You'll watch myself and one of our skilled nurses assess a patient who has respiratory illness. You will actually hear lung sounds, heart tones, and then putting it all together, we'll make a diagnosis together. We will also use an SBAR form. These SBAR forms have been developed to increase and enhance the communication between the nurse and the physician in the post-acute setting, particularly while we're talking to each other over the phone and we're not standing side by side. We'll show you an example of a respiratory protocol and a pneumonia pathway, which will also help improve our communication skills and decrease the amount of clerical errors that we see when we're treating patients in the nursing setting. So please relax, sit back and enjoy the video, enjoy the 2 exams that you'll be taking, and thank you very much for watching this Teach the Teacher seminar on pneumonia. Okay. Which patient do we have today?
We have Mr. Reed today. He's had a cough for about 2 days now. He's had a fever. He's had increased sputum production. It's been green. He's also had some dyspnea. He's weaker. He's not eating.
Okay, have you discussed his declining condition with the family?
Yes, and the family wants everything done at this time.
Patients with pneumonia can have varying presentations. They can get sick very quickly, or on occasion, they may present with an unusual fashion, sometimes just with altered mental status. Okay, let's go and see him.
Okay.
Let's come in and see how he does. Mr. Reed, it's Dr. Quinn. Coming to say hello to you, see how you doing this morning. I have my nurse with me, Pat. Okay, Pat, let's go and examine. Hi, Mr. Reed. I'm Dr. Quinn. How are you today? Going to leave my business card here for you so you knew who I was, okay? A lot of folks come in and out. Pat will put that on your desk. How are you doing today? Are you short of breath? Have you been coughing? Well, what we're going to do, we're going to check you out here. I'm going to do a little exam, then we'll figure out how to treat you best, okay? I'm going to turn up your oxygen just a minute here. Looks like you're needing a little bit of oxygen. Patients with lower respiratory tract infections, pneumonia, may experience shortness of breath with labored breathing, new or worsening cough, new or increasing sputum production, new or increased findings on lung exams such as rales or wheeze, or chest pains with inspiration. You're looking like you're hot today.
Mr. Reed has actually had a temperature of around 102. He's been tachycardic, heart rate's been around 110. Okay. Respirations have been around 22.
Okay. Symptoms of pneumonia include a loss of appetite or anorexia, fever and chills. Temperatures may be low or very high. Patients feeling clammy, headaches, fatigue and muscle aches, sometimes shortness of breath and dyspnea, cough with or without sputum production, coughing up blood or hemoptysis, chest pains with breathing, pleuritic chest pain, nausea with or without vomiting. Okay, alrighty, let's see how you do. Physical findings on patients with pneumonia include they may look very tired, flushing, and if they are quite ill, may have a bluish color to their lips known as cyanosis. They may be diaphoretic or very sweaty. They may be coughing. The pulse shows a tachycardia in the form of fast heartbeat.
blood pressure's actually been good. He's running around 110/70, and that's about normal for him.
He seems like he's got some rales in the right base. Rales and consolidated breath sounds are typical in patients with pneumonia. Mr. Reed, let me go look at your chart for a minute. I'll come back and talk to you in just a second, okay? Okay, you hang in there.
Mr. Reed, I'm going to leave your call bell here, and I'm also going to put your phone next to your call bell, and I'm going to put your TV clickers also next to that, so everything's in a row here for you if you need anything, okay?
Okay, let's look here. Have we had a chest x-ray yet?
Yes, we had a chest x-ray this morning.
Okay, let's see what we can find on that. Okay. Well, it looks like he's got an infiltrate in his right base.
Okay.
It looks moderate. I don't see a pleural effusion. Okay. Let me check his trend on his temperature here just a minute. O2 sats. Okay, I see his vital signs now. His temperature's been going up over the last day and a half, it seems.
Yes.
As well as his respiratory rate. Blood pressure really doesn't seem to be a problem currently.
Right.
Okay. What we'll do is we're going to discuss some treatment for him, right lower lobe pneumonia. And I'll meet you outside and we'll get some therapy going.
Okay.
And I'm just going to tell him how he's doing and so forth.
Okay.
Well, Mr. Reed, I've examined you and I've looked at your x-ray. It looks like you have pneumonia in that right bottom of the lung. I'm going to go outside now with the nurse and discuss some treatments for you and get these treatments going. You're going to be just fine. Any problems, my card's on your table. I'm Dr. Quinn. You just tell the nurse to call me, okay? All righty, thank you. Do you need anything before I leave? Okay, I'll get the nurse to come in for you. Thank you. This is a typical example of an SBAR form, which increases the communication between the nursing home nurses and the physician, particularly when they're over the phone or not face-to-face. This particular form is from the Interactive Forum. This is a typical example of a respiratory or pneumonia pathway. These protocols are very useful in standardizing care throughout the community and cutting down on the amount of clerical errors that you would see through the nursing home with treating patients over the phone. Well, thank you for watching Teach the Teacher seminar, particularly on this session on pneumonia. I hope your communication skills and diagnostic skills have been increased through the use of our pre and post survey and our video. The SBAR form, respiratory pathways, are an extremely important part of what we do nowadays in the nursing setting, and I hope this was of value to you. Your feedback is valuable, and if you would like to at any time contact me, please just check donaldquinn.com or call the number listed at the bottom of your screen. And again, thank you for watching the Teach the Teacher seminar.